Hi, we're here with Dr. Kristen Krajewski of the Veteran Affairs Medical Center. Kristen is a discharged pharmacist at the hospital, and she's going to tell us a little bit about what she does. What are your job duties as a pharmacist in the hospital setting?
What I do in my pharmacy and in my hospital pharmacy setting, my primary duty is to make sure that patients are getting the proper medications that they're supposed to get. I focus in on medication reconciliation, which means at time of admission and at time of discharge. We look at what the medicines the patients are taking when they come in, see what they're getting as an inpatient, what the new doctors have ordered, and at time of discharge, we make sure that they're sent home on the proper medicines, make sure that if medicine's discontinued, that we counsel the patient about that, fill any of the new prescriptions for them, and then we go to their bedside and counsel them on their medicines. Whenever the patient leaves the hospital, they walk out with a comprehensive list of all of their medicines, any instructions. So, for example, 3 of the medicines they were taking before have been discontinued, I write that right down for them and talk to them about that. Give them a list of all their medicines, including the new meds, any dose changes, so that whenever the patient leaves the hospital, they know exactly what they're supposed to be taking in terms of things they were already on before, new things, and make sure that they know everything they're supposed to be on. And this hopefully prevents them taking the wrong things or going home and not using the right medications.
So this role that you have as the pharmacist, as the drug expert, has a positive impact on healthcare at your hospital.
Absolutely. We've actually done studies. Initially, we only had 1 pharmacist in this role, and there was so much cost savings after the first year, we were actually able to generate 2 additional positions. So there's actually 3 of us working in this spot right now, and it's cut down substantially on the number of readmissions, just in general healthcare costs. We were able to cut down the number of new prescriptions being filled at discharge because they were the same things as they were already taking. We didn't reissue prescriptions, so there were no duplications. And in terms of, we make sure that patients aren't taking the wrong things. So it's definitely helped at our hospital and cut down on med errors and readmissions.
On average, how much would a readmission cost the hospital?
Readmissions, depending upon how serious the illness and how long an inpatient ICU stay, can be anywhere between $2,000 and $5,000 a day. And depending on how serious the illness, and when you look at this in the big picture, this could be a very, very significant cost savings. So if you can cut down on even 1 readmission each week, for a whole year, you could be looking at 52 weeks out of the year, hundreds of thousands of dollars.
That make a huge difference. Do you think of any individual instances where your role as the pharmacist or drugs expert made an individual impact on a particular patient?
I can think of many, actually. Specifically, a lot of high-risk anticoagulant medications. We also look at what they're on, if they're on an anticoagulant. So, say, for example, if they're on Coumadin, to make sure that they're getting the right dose. I have caught several major drug interactions with Coumadin and made sure that we adjusted their dose accordingly. That could have certainly hurt the patient if it wasn't done. And again, it cost another readmission. I've also caught one, I had one where a patient got admitted and they had a very serious condition in their kidneys, and the medication that was causing the problem wasn't actually discontinued when they came in. It wasn't realized by the provider. I called the doctor up and they realized it when I brought this to their attention and thanked me for it. So we got rid of that medicine. Luckily, the patient was able to recover. Had they not, they could have actually ended up on dialysis. So it was a very significant interaction that I had.
And one more question. How long have you been practicing at your current job?
My current job I've been at for 3 years.
Well, thank you very much for stopping by.
Thank you.
We appreciate your insights.